Smart Care. Sustainable health for the future.
Millions of people around Europe have to balance their personal with their professional lives. And that's especially difficult for carers, people who have to look after someone at home, but also hold down a full-time job. I'm here in Trondheim in Norway to meet someone who's been doing that for 18 years. Inger-Lise Lillefloth's husband Bjørnar has had Parkinson's disease since the early 1990s. Until she retired, she looked after him and had a regular job too. And she told me that managing both was a challenge.
I worked shifts, so I worked every third weekend and then days and evenings. And then it was up to me to find a replacement or to swap shifts if I needed a day off to go to hospital, for example. It was up to me to swap or to use my holidays or my overtime.
Using holidays and overtime hours to look after a loved one is typical of the kinds of problems that some carers face in their daily lives. And millions of people are affected. A recent survey of 15 EU countries found that 36% of respondents spent some time caring for a neighbour, friend or family member each week. So how can those people best balance work and care? Hi Lisa. Nice to see you. How you doing? Nice to meet you. Thanks very much for being available. I went to Oslo to meet up with sociologist Lien, who's been surveying the issue.
First of all, we interviewed some people who are in caregiving situations, and they are using quite a lot of time on caregiving. Some of them are. Others, like you and I maybe, we are coming into that caregiving situation sometime in our lives. So it will affect us all for a longer or shorter period of time.
What's the response that you'd like to see from employers? I mean, what do we need to do to kind of improve the situation for those people?
You have to talk about it at the workplace. You have to have a dialogue. So you also get the employer to know that you have an issue at home. You may have flexible hours. That was the main issue for those we interviewed and in our survey. Maybe you will find some measures for a shorter or longer time of a period that will benefit all, even the employer.
Establishing good dialogue between employee and employer and creating a flexible working environment is part of the solution. But there could be other fresh approaches too, according to health policy expert Professor Grund.
We have some good systems for taking care of your child and children. I think you could manage to have some kind of similar system, taking a little bit more care of the elderly people. It is difficult economics because you have both the financial short-time economics and then you have the more longer times benefits of it.
Back in Trondheim, and Inger-Lise echoes that idea. She believes that a form of financial recognition could open up a lot of possibilities.
For example, you could have a caregiving salary and then have some more free time, so you're not too dependent on having to go to work, that you have to go to your job every day, because it's quite demanding. So if you have a little more time off, then you can recover. Because if you have only one day off, it's often not enough.
After years of hard work, Inger-Lise is now expecting to be able to place her husband in a care home soon, allowing her to focus on spending quality time with him throughout her retirement.
Smart Care, in partnership with AbbVie.